All right, welcome back to the deep dive. Today we're going to dive deep into something that's really got everyone talking.
Yeah, for sure.
It's about the possibility of RFK Jr. leading the Department of Health and Human Services.
Yeah, the HHS.
Yeah, the HHS. This department's huge. We're talking about a budget of $1.7 trillion.
Wow.
That's a T-L-A-N-E and an R, trillion dollars. And the programs that the HHS oversees affect, I mean, it's got to be like, what, half of all Americans, right?
At least.
So we're going to take a look at RFK Jr.'s views on vaccines, abortion, food. I mean, he's got a lot of interesting ideas that could have a major impact, on everyone in the country. So just to make sure everyone's on the same page,
Sure.
could you maybe give a quick overview for anyone who might not, know RFK Jr.'s whole story?
Yeah, absolutely. So Robert F. Kennedy Jr., comes from a very prominent family.
Yeah, definitely.
Very famous. He's actually known for like his work in environmental activism,
Right.
but he's also known to be a bit of a controversial figure.
He's not afraid to ruffle some feathers.
Exactly. Yeah.
Yeah.
He's been, challenging a lot of conventional wisdom,
Yeah.
especially in the public health world.
Right. And one of the, I guess, the biggest areas where he's been, stirring things up is the whole vaccine debate. He's been a big advocate for what he calls medical freedom, essentially arguing that individuals should have more uh, control over their own health decisions, even if those choices, maybe go against the grain of like mainstream medical advice.
Yeah, and his stance on vaccines has, it's made him really popular with some groups,
Sure.
but it's also caused a lot of strong pushback from, like doctors, scientists, public health experts.
The medical establishment.
Yeah, exactly. I mean, they argue that he's basically fueling this like distrust in vaccines and that this actually has, serious real world consequences.
That's a big claim.
Yeah, I mean, they point to things like, what happened in Samoa. There was that measles outbreak, and a lot of it was because of vaccine hesitancy, fueled by misinformation.
Wow.
They argue that, RFK Jr.'s rhetoric actually plays a role in that kind of thing.
So they're saying that because of his, very outspoken views, that there's a link between that and people choosing not to vaccinate
Exactly.
and potentially, outbreaks and things like that.
Right.
It's an interesting point, but isn't there also this argument that, people should have the right to like make choices about their own bodies?
Oh, absolutely.
Yeah.
I mean, that's at the core of the whole debate, right? Like, where do you draw the line between individual freedom and, the responsibility we have to protect public health?
Right.
And it's a question that becomes even more crucial if RFK Jr. ends up actually heading the HHS, like, will he try to implement some of these more controversial ideas that he has about vaccines?
Right. Or will he, I don't know, moderate his stance when he's in this new role?
It's a big unknown.
It's a big one.
It is.
And the impact, like on everyone's health, on the whole country's health.
Totally.
That's a lot to consider.
It is. And, it gets even more complicated when you look at how his views on.
And this next one, it might seem like a bit of a jump, but it's another area where RFK Jr. has, strong opinions, and it kind of ties into his whole focus on personal choice, and that's food.
Food and agriculture.
Yeah, food and agriculture. So, I mean, he really wants to see, America become healthier, but
Yeah.
His vision kind of bumps up against, some pretty powerful interests.
Oh, for sure. It clashes with, the realities of a very big industry.
We're talking about like the agricultural industry.
Exactly.
Farmers, especially in the Midwest.
Exactly. Yeah. Because, RFK Jr. has been very outspoken about his desire for, a healthier food system for America. He's called for, banning things like corn syrup and, certain pesticides.
And that's not going over so well with everyone in the farming community, I imagine.
Not really. There's a lot of concern, worry, even fear about, how their bottom line would be affected. Farmers, are worried about losing markets, costs going up. It just, really shakes up the way they've been doing things for a long time.
Yeah, so you've got his vision, this picture of a healthier America butting up against the reality of a huge industry, with real economic consequences.
For sure.
And when those two things collide, I mean, what's going to happen?
Right.
Who's going to win?
We'll have to see. It sets the stage for some, probably very heated debates.
Yeah.
About whose interests are actually going to win out in the end.
And speaking of powerful forces, we can't ignore, the political opposition that RFK Jr. is facing. I mean,
Absolutely.
this isn't just a few people grumbling. This is like a full-on organized effort to stop him from getting this job.
Right.
I mean, he's facing opposition from, like, we're talking about people like former Vice President Mike Pence.
Yeah.
Big names.
Yeah. And it's not just coming from, one side of the political spectrum.
Right. Because, his stance on things like vaccines, like we were talking about earlier, it's rubbed people the wrong way across the board.
Totally, yeah. You've got health advocates, Democrats, even some conservatives. They're not comfortable with some of his views. It's a pretty diverse group of people who are against him.
But you know what? Even with all that, even with all this opposition, there's still a chance he could be confirmed.
Oh, absolutely.
You can't, like, ignore the power of the Kennedy name.
Yeah.
Yeah.
And he's also talking about these issues that, really appeal to people on both sides of the aisle. Like,
Yeah.
who doesn't want healthier food?
Right.
So I think, his celebrity and him focusing on these more bipartisan issues could really win over some of those, those Republican senators.
I think it all comes down to the Senate hearings. Can he, convince enough people
Yeah.
that he's the right guy for the job?
Will he be able to, like, unite enough Republicans to actually get confirmed? It's going to be
Yeah.
interesting.
Oh, yeah. Okay, so we've talked about the controversies, the opposition, this political tightrope he's walking. But let's not forget, RFK Jr. has a vision for what he wants to do with the HHS. He campaigned on this whole idea of, making America healthy again. But, what does that actually look like if he gets to put it into action?
That's where it gets really interesting
Yeah.
because, the slogan's catchy, but when you start looking at the nitty-gritty of his plan, it's more complicated than it seems. And it raises a lot of questions about, how realistic is this?
Right. Can he actually pull this off?
Right. What are the unintended consequences? Like, there's a lot there.
There's a lot there. Okay, let's break it down. What are some of the things he specifically wants to change?
Well, like we were talking about earlier, he's a really big believer in changing how our food system works.
Right.
He wants people to eat less processed food, use fewer pesticides, and he's all about organic and local produce.
Sounds pretty good so far.
It does.
Right.
He also wants to make it easier for people to access, alternative medicine
Okay.
and, really focus on preventing people from getting sick in the first place.
Right.
So, big picture, it sounds great.
Yeah, I mean, who wouldn't want America to be healthier, right?
Exactly.
Yeah.
But I think his critics would say it's not that simple.
Sure, they probably argue there's more to it than that.
Yeah. Like, if you drastically change how farming works in this country,
Right.
you could end up with higher food prices,
Sure.
maybe even food shortages.
Yeah.
And some of his ideas about alternative medicine, they're a little, out there.
Not exactly mainstream.
Exactly.
So there's this tension, right, between his vision and the challenges of actually making it happen.
For sure.
It's not as easy as just saying, let's make America healthy.
Absolutely. And I think that's something we all have to think about. Even if you agree with his goals, in theory, you have to think about what are the trade-offs? What are the unintended consequences?
Right. Because what looks good on paper, it doesn't always work out so smoothly in the real world.
Absolutely.
And that's what makes this whole thing so interesting, right?
Yeah.
It's not black and white. It's not simple. It's this whole web of, like, personalities and politics and beliefs.
Absolutely. And I think that's what makes this, this deep dive so valuable for the listeners. We're not trying to tell anyone what to think.
Yeah.
We're giving you the information you need to form your own opinions.
Yeah, we're just trying to help you, understand what's going on and think critically about it.
Exactly.
And hopefully, you'll stay engaged and informed as this whole story continues to play out. Because, I mean, this is a story that could really change the future of healthcare in America.
Totally. Yeah, the decisions made at HHS affect everyone, so it's really crucial to understand the different viewpoints.